Ladies and gentlemen, this is Andrew E. Guy. Welcome to another episode of the Ilirpodcast. I'm listening. I'm ready. It is the podcast is dedicated for those who are on the go, whether you're traveling by land, air, or sea. This is me, Andrew E. Guy. Truly, I'm excited about today. And we do this every week. We just bring the excitement. I don't think it's the excitement. You know what I think? I think it's the people that are disrupting normalcy. We're talking about the experts. We're talking about the thought leaders. We are talking about people in government. We're talking about people in the healthcare system, in education, entrepreneur. Today, we got one of those individuals that you have got to hear his story. You have got to see what he is doing out there to transform and disrupt the healthcare field. I'm talking about none other than my good friend all the way down there from San Francisco. His name is Dr. Jason Wong. He's a PT and a DPT and an OCS. Now, there is so much more to tell you about this gentleman, but he's a father, he's a dedicated practitioner who lives what he talks. He walks the walk, and he wants to help you to understand more about how to take care of yourself, but also to shed some light on what you need to do in terms of taking care of yourself, for preventative tips and also some eye-opener about what you need to be concerned about when it comes to your health and your care and putting yourself at the risk and in charge of somebody else watching over your life. Without further ado, ladies and gentlemen, please help me welcome to the Ilirpodcast stage Dr. Jason Wong. Dr. J, say what's up to the people.
Hey, what's up, everybody? How are you guys doing? I'm doing great. So thank you for inviting me here. Really appreciate it.
Dr. J, how you doing, man?
I'm pumped, man. When I saw your podcast and you're disrupting normalcy and just allowing people to get a different perspective on healthcare and whatever other industries that we feel, are compelled that we need to change. That's what I'm here to do.
I absolutely love it. Love your work, love your movement. Basically, as an expert online, they call you Flex with J. Flex with Dr. J. Well, where'd you get that from? That's unique, man.
Well, I think one thing for sure, back in 2019, I quit corporate physical therapy. And some of the reasons why I quit was because I wanted to do more for the world. I felt that I was kind of just stuck. There was a lot of regulations and different things that I could not do. For example, I was starting to treat people more as a number than as a person. I was seeing 16 patients a day. And it was tiring myself out. I thought that I was going to get burnt out by the age of 38. And not just that, but I just saw that there was a lot of things from the triage, from like the doctor to referring people to the physical therapy. First things that they prescribe are like pain medication and getting an x-ray or an MRI. And little do people know that was actually setting people up for failure going into the PT clinic, because they're like, okay, well, I have arthritis, I can't exercise. So there's all these things that they're instilling fear, and there's instilling a lot of fear and anxiety into people prior to even going into physical therapy. So that's where I eventually, 2019, Flex with Dr. J occurred. And I started off with just an Instagram, no program, just posting things about the things that I'm passionate about and the things that have helped me to escape my issues. And we can go into that a little bit. But, Flex with Dr. J was born because I am a physical therapist that preaches what I teach. And I believe that strength training and lifestyle changes are some of the main things that people need to do in order to live a pain-free life. And I think little people know that majority of pain relief comes from all these different passive modalities. Don't get me wrong, passive modalities like ultrasound, TENS units, getting an adjustment, getting a massage, those are not bad things, but they're also not long-term fixes at all. In order to fix the person, you need to be able to fix yourself and address your own biases on what actually works and what doesn't. So I am all about changing the person, changing the lifestyle, and living a life free of pain by way of becoming a stronger, more resilient version of yourself.
Can the audience say amen up in here? Dr. J just threw down. And if you didn't know, now you know. Now, wait a minute. I know we came out of the gate there, Dr. J. We came out like Mike Tyson.
A little too quick.
We will no. We come out to let them know what's about to take place. I love this. Now, listen, before we even go any further, because, it's a practice of ours at Ilirpodcast is to let people know right off the bat, we plug our guests right up. We don't wait until they go to the conversation and then wait at the end. Then we can say, oh, by the way, where can people find you? I want people right now to either jump off of this interview and go look you up because of the stuff you're about to throw down. So if they are wondering where they can find you, listen, you need to go and find flexwithdrj.com. I'm going to spell it out because I want you to know where to go find this man. He is disrupting normalcy of what we think healthcare is all about. He's on a movement. Flexwithdrj.com is FLEXWIThdrJAY.com. Listen, get out there. I want you to check out Dr. J because what he's going to help you to do is about living a lifestyle where you take the control reins and you are riding in your own time, in your own way, living your life. Dr. J, I'm excited right off the top what we're about to do. Listen, man, I'm so pumped. I have to tell you how I came across you. I saw you on Instagram and then I was watching some of your video and I'm like, no, I've got to reach out. I didn't waste time. I said, listen, I got to reach out. And it didn't matter what race you were. It didn't matter what color you were. It didn't matter. You were talking my kind of language. I don't speak Oriental or Chinese. Right. Most of what I say is probably Nihoma. I'm not sure if you understand what that means. Or
absolutely.
Or Shishini. I learned that from Jackie Chan anyway, by the way. So that's the most Chinese I know. So you're going to have to help me out. I got an Oriental friend who's going to teach me now. So very good. But anyways, I went to check out your stuff and I saw a PT that's actually doing exercise. I saw a PT that was actually lifting weights. I saw a PT that was practicing, that wasn't just trying to fill up the calendar to make sure we book so many clients for such a long period of time. In other words, I've been through the game, right? I was a rehab therapist, and my goal, you were seeing like 13, I was seeing like anywhere from 15 to like 19 clients, right? Yep. That's a lot. And you think that you are trying to do restorative treatment. Listen, by the time you fill out the first 10 SOAP notes, you're thinking, oh my goodness. And for the people who don't know what SOAP notes are, I'm going to let you expound upon it. But it's talking about subjective, objective, and then assessment and plan of treatment. And that's basically what all practitioners use, right? Yep. Doctors use it too. And so what I want to kind of talk about right now, it's like we're both pumped, we're both energetic about the same topic. But I'm here for you because I want the world to know who you are and where to find you, how to get help from you.
Appreciate that.
What made you develop this mindset? Yes, you were in corporate. I was in there too. And then I had to leave. So now I do personal training. I still do the same thing. But now I can get to help my clients. And I'm going to tell you about a testimony after we get into the conversation here. What made you just give up on the corporate stuff and start doing your own stuff? Talk to us.
Well, don't get me wrong. I mean, I think that when I was working corporate PT, I mean, it was money in the bank, to be honest. I live in San Francisco. It's one of the highest paying physical therapy cities in the entire world. So, I was thinking, okay, this is going to be my dream come true job. Let me stay here for 30 years. Let me get my 5-year pension, 5 years and then stay. And then that was going to be my ticket, to freedom, at least financial freedom. But even then, I started to see just the kind of PTs that I was surrounded by, to be honest. It wasn't all of them, but I was seeing PTs that were, for example, there was a person that was on a leg press and he had a knee surgery. And then, they were just asking their PT like, hey, is there any opportunities? Do you think that I actually will be able to run? And legitimately, the words that came out of their mouth was like appalling. They laughed at them and they said, huh, with your knee? No, you can't run. And then, so like, that was the type of care that I was seeing in the clinic. I think some people that were just tired of, just delivering the quality of care from when they started, And they started to lose sight. If you actually break down the word health and care, there's actually the word care in there. And I think that so many practitioners and people out there have lost sight of the word care in healthcare. For example, when you're looking at your subjective, objective assessment and plan, one of the biggest things that you actually need to do is learn about the person. You actually need to ask, hey, Andrew, how is your neck? And you're asking about a body part versus saying, how are you, Andrew? Like, how are you doing?
Yes.
And then when you start to ask the right questions, believe it or not, I have just legitimately just asked 10 or so questions, and the person is like dumbfounded. They're like, wow, I've never been asked those types of questions. You're actually trying to get to know me. And the truth is that 50% of the battle when it comes to a positive outcome to you either getting back to the sports and activities that you love, or even or for that matter, just relieving your pain, 50% of all outcomes comes from a positive therapeutic alliance. And all that means is you've actually trust the therapist and you actually believe that they care for you. Now, if you don't believe that they care for you, then that's an issue, because 50% of the outcome, you're leaving half the battle off the table already. You're setting yourself up for failure if you feel that your therapist doesn't have your best intention in mind. So that's why I started what I did. I started an online virtual platform where we're not held by documentation standards. We're treating people like a person, and not just that, but we're treating the lifestyle. One of the biggest things, and you'll see it all over my Instagram and Facebook and a whole bunch of places, is I have crazy eccentric habits that keep pain away, and I think that prevention is not sexy. Aesthetics, six-pack abs and booty, that's sexy, but actually prevention of chronic injuries and chronic illness is not sexy. And that's why it's harder to sell people on the fact that if you can prevent pain from occurring, why not do that instead? If we brush our teeth every single day to prevent cavities, why don't we do enough exercise in order to prevent chronic pain? People wait for chronic pain in order, they wait for chronic pain, they wait for pain to become so debilitating, they wait for the wheels to fall off that they, then all of a sudden it's just like, well, now I have to do something about it. But now you're working backwards because you've gone through a severe injury of that nature. So why not prevent? Why not create the lifestyle that you want in your 20s, 30s, 40s, maybe even 50s, and actually live out a proper, decent, pain-free retirement? But people don't think that way. They think that I can just go through life and just seek out the passive modalities that are just going to lead to a long-term cost over the long run. And that's the thing, that's the gripe that I have with the healthcare system, is we're all about treating the pain, but we're not treating prevention. And prevention is harder to reimburse for. I totally understand that, but that's the type of message I'm putting out there. If we can prevent pain from occurring, that's going to save obviously on a lot of healthcare costs, and it's going to save you a lot of the gripe of 10, 20 plus years of living with the same exact pain that you started with. So that's
goodness. Me. Ladies and gentlemen, if you listen to me for the first time, this is Andrew E. Guy on the Ilirpodcast, and you are listening to myself and Dr. J1. Listen, he's winning it. He's already won it. Did you get the last name? Won, okay? So I'm trying to tell you, he wants you to win. And you're going to go back and you're going to tell your friend, listen, I went out there and I'm a winner, and I win because guess what? Dr. Juan helped me to see that, hey, I'm a winner. And you know what? 2 years from now, 3 years from now, you can look at your pain and your chronic pain and say, you know what? I won that battle. I won that battle because somebody spoke into my life. Now, Dr. J, we know we're on the same boat. I have a background in rehab therapy also. Yep. But what I want to do is I want to break things down so people can really understand this, right?
Sure.
So we know that they are not trying to treat the person to get better. And that's the system that they're selling our clients, so to speak. The longer we have them in a treatment roller coaster, especially if you're in a multidisciplinary clinic, because that's what I was working in, where they come in and they run you through the gamut. They check to see, okay, how is this person's insurance? Great. Everybody looks out through the door and they give the other practitioner a thumbs up. Great. We got a good one here. We got a gold mine here. So let's check in for rehab therapy. Let's send him over to the chiropodist. Let's send him over to the massage therapy, and definitely, P, send him over to the back cracker. We got to get that back adjusted. Now, when we talk about all of this, by the time that person is finished, they could spend anywhere from 1 to 3 hours in a clinic on just that one visit. I came there because I had a foot problem, right? I had an issue with my anterior tibialis. And then for people who don't know, is that muscle right on your shin bone that allows you to do dorsiflex, to bring your toes up, right?
Right.
And so what happens now, they end up spending that 4 hours inside that clinic and leave and didn't feel help, because all the practitioners are concerned about is how many times can I get this person booked for the month so I can erode their insurance. I've been there. I've done that. And so I am excited about what you're doing to let people take treatment in their own hands. But now, to educate them, can you talk to us about some of the fear tactics that they actually unload on these clients the moment they get into the door?
Yeah, I mean, I think that, you know, there are certain practitioners that are trying to induce the fear into people, right? Because, you know, that's part of sales right there. It's like you want to dig into the pain, you want to provide a solution, and you want to see if you can move forward with it. And I think that's what some practitioners are actually in the mindset of. Some obviously are actually just oblivious to it. They don't know that they're actually stuck in a system that's actually doing things this way. But there's just a lot of different tactics.
And Dr. Wong, sorry to cut you. I'm glad that you say some, because not all are doing that.
Yeah.
There are some really dedicated ones who are actually doing the right thing. So let's make sure we are putting that disclaimer. Not all of them are thinking in a box. Some of them are outside of the box, and they're looking out for the client's best interest. All right, continue. Go ahead.
Yeah, for sure. I mean, like I said, it's not there's going to be good and bad in every single industry in the entire world. And you hope that you're going to find the right therapist. I find that I'm a good therapist, but you know, some of the things is like when you're going from one system, for example, if you're an HMO clinic and you're going to the MD first, usually the MDs is sometimes not their fault as well. A lot of times the first thing is because they don't have the bandwidth to hear your story for 30 to 60 minutes, right? They have to get you in and out, and that's just part of the system. So they're going to prescribe you the easiest things that are going to allow you to help with your pain. And what's the most immediate that's easily billable that they can give to you? Pain medication, opioids, Voltaren, you know, all the different things, epidural, they can get you to get an injection, for example. And then after that, then they'll say, hey, well, my pain's so debilitating, let's get an X-ray and MRI. So this is one of the biggest things that was my biggest gripe in this corporate PT was when you get the radiographic imaging, it's all these words that the client does not understand whatsoever.
Correct.
Multi-level degeneration, sequestration of L4, L5. They have no idea what that shit is. So the thing is that you are actually setting that person up for failure, especially if a radiologist or somebody is actually going to describe what's going on in your body. How is that going to make that person feel? Is it going to want them to actually do deadlifts or actually do squats or things that are more conducive?
Absolutely not.
No, it's going to set them up for failure. They're going to have fear avoidance behavior. So it's going to start catastrophizing over their pain and start feeling helpless. That's part of the chronic pain cycle. It's rumination, it's helplessness, it's pain catastrophizing, it's fear avoidance behaviors. Little do we know that these fear avoidance behaviors were not just set from multiple, like, oh, I pulled my back a couple times. It's actually set from the healthcare system itself. We're setting them up in a position where they are going to go down this fear-induced cycle and not do well in physical therapy. That's why I am so big about the education piece. I know that I'm going away from like the fear part, but that's why I'm so big on the education. Education in itself is one of the poorest reimbursed in the billable system. You get reimbursed more for manual therapy and therapeutic exercise.
Correct.
Hence why the first thing that you do is you get an adjustment, or because you can bill more for that.
Exactly.
You actually can't bill a lot for education, but in the way that I do it is that I educate enough so that I have a person that had severe back pain, could barely like touch their knees bending forward, And all I didn't touch them because it is virtual.
Correct.
I didn't touch them. All I did was educate and say, hey, it's perfectly fine. This is something that everybody goes through. By the way, and it's the education piece that allows them to confidently, by the end of the session, he was touching the floor. And
wait, hold on. Listen, guys, I listen, I gotta do this. Listen, guys, listen. If you're listening to me for the first time, this is Andrew E. Guy on the Ilirpodcast with Dr. J. Listen, if you're listening to this information, if you're having any kind of chronic pain, if you have been debilitated, if you have been induced by fear and the word can't do and never will for the next couple of years, or you need to be on pain meds, or listen, if you need freedom from this stuff, I need you to run, skip, hop, jump, fly, and get over there to flexwithdrj.com. Let me say that slowly. Go now to flexwithdrjay.com. Go get the help that you need. Dr. J, hit him up.
Yeah, I mean, so for sure, just based on the fear-inducing behaviors that are more induced, not just from their own injuries, but from the healthcare system itself. And I think that's, again, the biggest gripe. There's something called direct access here. It's I think 48 out of the 50 states here have direct access, meaning that you don't have to go to a doctor. Doctors are good at what they do. MDs are good at what they do. There are the jack of all trades. They understand every single system, but you are actually allowed to seek out a physical therapist right off the bat. And we are the musculoskeletal experts. We are the ones that do and can educate you on how to relieve chronic pain without medication, without manual treatments, right? Manual treatment, like I said, disclaimer here, medication in itself, manual treatment, it's not bad things in itself. But the thing is that that's the only thing that is being prescribed. There is no active treatment after. There's no lifestyle changes, right? Again, the education piece is so pivotal that, easily I can be talking to a person and all I need to do is just educate somebody about being comfortable, not being fearful, instilling confidence in the person. One of the biggest things is instilling the confidence that you can move. Yes. You don't have to be limited by pain. Right. And then once that happens, you'll be surprised that these people that are stuck, spending tens of thousands of dollars, for a few years, and then they just spend one visit, with me and my team. And easily enough, within 20 to 30 minutes, it's like they're moving their neck better than they ever have in years. Mm-hmm. And that's not a trick. It's not something that we're tricking them into doing things. It's the fact that we actually care. That's one. And like I said, the therapeutic outcome is that important. But number two, we stress the education portion to put the power back in your hands, right? I'm not your chauffeur. I'm not going to drive you everywhere. I'm not going to have you depend on me. I'm going to give you the keys to drive your own car. And if you can do that, that's what's going to allow you to live a pain-free life. And I'm going to see you less. I'm going to see you from afar, cheering you on, with my pom-poms, but I'm not going to lead you on and actually say, hey, you need to keep seeing me over and over and over again, right? That's not the deal. That's not what healthcare is about.
Ladies and gentlemen, again, if you're listening to me for the first time, this is Andrew E. Guy on the Ilirpodcast with Dr. Jason 1 PT DPT OCS. With years of extensive knowledge in exercise science and physical therapy, Jason, Dr. J, Flex with Dr. J, is dedicated his life to helping people with chronic injuries or pain through exercise and lifestyle modification. One of the best things that you do, Dr. J, and I've noticed it on your platform, is the education. You educate people, and you touched on that. A lot of the doctors don't have the wherewithal to educate their patient. They don't have the bedside manner, not alone the bedside, they don't have the time to spend with the patient to explain, say, okay, this is what's happening, this is what you need to do, and this is how it can help you. They don't. They just, hey, here's the pill, here's the prescription. It's like they're licensed drug dealers. I hate to say that because I got family members who are doctors too. But I hope that when you go in there, you're not blinded by the system and that you can actually think for yourself and think health care, which is where we're going to go right now. So when we talk about health and care, health and care, they go hand in hand like a sandwich. Can you break down from your perspective, Dr. J, health care? Not from the traditional in the box thinking, corporate thinking, but from a personal lifestyle. What is healthcare to you? Take it away.
Well, I think healthcare to me, I guess it can start with like what my chronic injuries to in the past. And I think that why I'm really good at treating is because I lived that life. I fell from 8 feet up and I fell directly on my neck onto concrete, and I went through 2 car accidents and I was living with a lot of chronic pain by the time I was age 19. A lot of neck and back issues that didn't go away with standard care, like chiropractic services and getting weekly massages. I was continuously told that I was misaligned. It wasn't until that I educated myself and did years of research myself was I able to treat myself, and all of my pain went away within 1 week. And all it took was being educated. And again, I stress the education part again. So, I mean, I think that when it comes to, I guess the overall way, and I kind of about the question. What was the exact question again?
The question really is, can you break down, help the people, help my viewers understand the difference between health and care and their responsibility? So here's health, here is care. How does it come together? And what can you do to take back or take charge of your health?
Yeah. So part of it is like, you have to understand that words do harm. There's that saying of sticks and stones may break my bones, but words will never hurt me. That's completely false when it comes to healthcare. When you're hearing things about, okay, you have a meniscus tear, oh, you have arthritis in your neck, all these thoughts start to ruminate in your head. That leads into a culmination of a chronic pain experience. There's a thing called the biomedical model where they associate pain with a structural cause. But when we do more research, we actually start to figure out that there's these other biopsychosocial factors that play into pain. So when we're actually caring, when we're actually putting the care back into healthcare, we need to think about the entire person and not just, okay, I have a person with neck pain, let me go ahead and just treat the neck or adjust the neck. We have to think about asking the right questions about their lifestyle, their behaviors, the experiences that they've been through that caused this fear and the fear-inducing behaviors that led to this person feeling this way. So when you start to hear the person again, when you start to ask the right questions, you get the buy-in, you start to understand them more, and they start to lean in. When they start to lean in, you can tell that they're actually listening to what you say. If you have a practitioner that's going like this, and he's like, so Andrew, how are you doing? And he's like typing, and he's just looking at his documentation. He's worried more about his documentation. That plays into the experience. Yeah. That's the experience that the person feels. They feel that their therapist is apathetic and they care more about the documentations and keeping up with that rather than treating the person. I've seen it so many times where, you're in a clinic and this person's doing an exercise and then the person goes to them for a little bit. The therapist goes and he goes, oh, how you doing? Good. Am I supposed to do it? It's like, yeah, do 3 sets of 10. And then they just go back to their computer and they immediately ignore them again. And they continue to document. This is the type of care that we've forgotten in terms of the word healthcare. When you care, you're spending time with a person. You have full eye contact. You're fully engaged and you're fully committed to their long-term health. And you're not just trying to get them out of pain. You're trying to change their life. You're trying to change the lifestyle. So that's why I asked the questions of, Andrew, what type of equipment do you have? Okay, what time available do you have to work out? What sort of things, how much time can you commit to working out? How do you feel about doing this? Are you fearful? Okay, let's try to modify this. And then you ask the right questions and you customize the program into their life. That's how you're going to get long-term change and long-term buy-in, by interweaving exercise and mobility things into their lifestyle. Train the habits, train the person, change their mindset. And that, I believe, defines what healthcare should be.
Dr. J, whoa. You're throwing down, brother. You're throwing down. Oh my goodness. Listen, all right. So we hear so many gems coming here, so many gems. When we talk about chronic Can you define chronic? I'm going to answer some other things. I'm going to clarify some other things so other people can understand what's happening. But when you think about chronic, what does chronic mean? Because you're a chronic pain specialist. What does chronic mean?
So chronic in its form, I mean, chronic by definition is any pain that lasts beyond three months. And usually 3 months, why they say that is because people go through phases of inflammation, right? There's like the inflammatory phase, there's a remodeling, and then, there's proliferation and there's remodeling. Right. So after 3 months, usually with most injuries, unless it's a pretty catastrophic injury, most injuries do heal over time. Right. However, the structure heals, but sometimes the person doesn't heal, right? The brain doesn't heal. They're still thinking about the fear. They still think that they're a fragile version of themselves. And so some people go down this route where after 3 months, some people will immediately just go back to what they're doing, and that person lives their life. And then a good amount of people, because again, of all the different apathy and different types of poor healthcare systems out there, a lot of people will venture down this route where after the inflammation's gone, after the tissues have actually healed and there's no inflammation whatsoever, they will still be thinking and ruminating and feeling helpless about their pain. And that, therefore, again, people think like, Dr. J, I'm inflamed again. My neck's inflamed. But it's like, well, your pain's been going on for a while. It's not inflamed. It's just that you're actually, there's a lot of fear-inducing behaviors that we need to overcome. And that's what chronic is. Chronic is a specific type of pain that's culminated from multiple experiences from your behavior, culture, and everything. And it's not marked by inflammation. It's a pain that lasts, that's beyond actual tissue damage.
Awesome. So guys, when we talk about inflammation, we're really, in layman terms, we're talking about swelling, right? So I want you to think of, my palm here is a bag or a container, or we can think of the acetabulum as this joint space, and then this is the femur into that joint space. So this is the bag. Okay, this is the things that you're putting in, your shoes, all those things you're putting inside the bag. The more stuff you put inside the bag, you fill up that space so there's less movement. In other words, this would be the acetabulum, the hip joint, and then this is the femur inside this area. When there is swelling or inflammation, that means there is less movement. That's the body's way of telling you to stop. Right? To shut that joint down or space down so it can begin the healing process, right? So that's really what inflammation is. As practitioners, we call it inflammation, but really it's swelling in the joints that reduces mobility. Okay. Dr. J already talked to you about what the chronic part of it is, but what I also want you to understand that you are in charge of your health, right?
Absolutely.
The caring part is the educational part. The person or the practitioner who sits you down and try to help you to understand so you can be empowered to do these exercises outside of the clinic, that person cares about your health, and you're having that total experience of what health care is. Health care, Dr. J, is a teamwork, right?
Yeah,
it's a teamwork.
Absolutely.
But I'm going to ask you this question, though, Dr. J. Have you had patients, right, who were not facilitating the exercise, the take-home exercise that we all give them and say, hey, you got to do these every day? Have you ever had patients who really didn't follow up, weren't doing the exercise, and then when they come back to see you the next time, they are far behind than they were when they saw you the last time? Can you talk to us about what causes that and what would you do to change that mindset so patients can have that buy-in and start working on the exercise plan?
Yeah, I mean, I think you answered the question just right off the bat, right at the end, is the buy-in, right? And I think the buy-in comes from this. When I sit a person in front of me and I'm evaluating exactly what's going on, first, again, subjective, I'm going to ask the right questions and really understand the person. Secondly, on the objective, I'm going to empower you by teaching you how to get rid of yourself. And I'm also going to give you the why behind the exercise. My biggest gripe and one of my pet peeves is people that give these generic pieces of paper or exercises that you can find on Google and say, here, do these, and like not give the why, not give the how, not actually tell them exactly how to do it. And then so here's how I get buy-in, and I'll just tell you a little bit about my process. One is I check range of motion. Obviously, that's like a standard thing that we do in physical therapy.
Correct.
Then we kind of check and we see functional movement. So what does their squat look like? What does their overhead movement look? How does overhead look with load in their hands? Does that affect their neck? Does that affect their back? And then once we start to piece together some of these things, I call them comparable signs. That means that when we find a specific movement that causes the pain, I always tell the person, hey, because we reproduced your pain in the clinic or reproduced the pain right in front of me, that actually is a good sign that we can actually remove the pain with some form of exercise or modification. And like, oh, really? Like, that's awesome. That means that I'm not just hurting myself. And then afterwards, you prescribe a specific exercise based on what the root cause of what I feel would be. You apply 1 to 2 exercises. Guess what you do after the exercises? You don't say, here, Andrew, take the exercises, go home, do it. No, you retest the movement and you get buy-in and you say there is proof in the pudding because you just did this 5 minutes ago and now your range of motion's improved. Now your pain is better with doing the same exact movement after you did the exercise. So what did we do? We did a cause and effect. We didn't just apply an intervention, say, do it, here, do 3 sets of 10 and just give them some generic protocol. We actually put proof in the pudding. And not just that, then afterwards I say, here's why that worked. Here is why this worked. And you give the why behind, here's the muscles that you're working. Here's the reason why you were having pain before. And then therefore, this is why you need to do it multiple times a day. You need to incorporate this, but guess what, Andrew? You're sitting at a desk for 8 to 10 hours a day. So these exercises are not going to outweigh your lifestyle changes. So guess what you need to do? Get off your ass. Start stretching more throughout the day. Set alarm clocks, set auditory, verbal, and tactile cues that are going to cue you to do the exercises that you did in the clinic so that way, if you do it multiple times a day, you're creating a positive buffer in which if acid is the pain, you're creating that buffer that weighs against the pain. And therefore, that's how you actually make change. That's how you actually get buy-in when it comes to an exercise routine. Does that make sense?
It makes perfect sense. But here's what's happening here. What's so amazing about what you're saying, Dr. Juan, is that you're getting buy-in, but you didn't sell them anything. Most people, when you hear buy and sell, you sell me something. You sold me a program, or you sold me a treatment, or you sold me another 8 weeks of treatment, which are not really necessary. You're getting buy-in because you show that you care about the person holistically, not just about that pain meds, not just about your little exercise that you put on a piece of sheet, but you care about them and their lifestyle. But one thing I wanted to clarify for the viewers is that when we talk about modification, Dr. Juan, when we say modification, really what we're saying is that here's an exercise that you may not be able to perform at this level, but that will modify it. So that means you are able to complete it successfully without injuring yourself. Does that sound right? So we're making sure you can do it. We modify it to make sure you can do it successfully without re-injuring yourself. Dr. Juan, this conversation has got to be had another time. Listen, I got to tell these people where to go find you. Ladies and gentlemen, if you are looking for a specialist, a person that cares about your health and your well-being, a person is not going to give you the fluff, a person who is definitely not going to just hand you out some exercise and send you out the door. He's going to go through the soap method. He's going to soap it up, and he's going to talk to you about what soap is. Soap is subjective. That's getting to know you as a person. What do you do for a living? What do you love to do? When did you injure yourself? How? It's the whole gamut of getting information about you because he cares about you. The objective is just his point of view when he got information from you. Okay, the assessment, once he got his assessment, he's going to find out range of motion. Are there things you're able to do that you're not doing? And what is the complaint about? And after he got all of these information, he's going to come up with a plan of action. That's the SOAP method. All medical professionals use this plan of action. And if they're not using it to treat you, you need to find somebody else. You need to give Dr. J a call, and I'll give you exactly where you need to find him. You need to go and look at him at FLEXWITHDOCTORJAY.com, and you will get your answers right there. Dr. J, listen, I value your time. I'm telling you, I know that we gone over, but it was well worth it. But what I wanted to do right now, this is the part where I wanted you to kind of run me through, take me about a minute or so to run me through why should people come to you? Everyone has bought into the system. Everyone is comfortable because they can just put it on their insurance and the insurance will cover it. Why should people just leave the in the box, the jack in the box, healthcare system and come to someone like you who really cares, who can give them the result that they want? Why should they come? And then in that also tell them where to go and find you and what you offer. Go.
Yeah. So, I mean, just to start right at the back, again, you can go to www.flexwithdrj.com. I also have a free Facebook group. It's Pain Relief, Strength, and Mobility by Flex with Dr. J. So if you wanted to look that up on Facebook, you can. And then I have an Instagram. I mean, there's obviously thousands of exercises, but I always tell people you want to assess, don't guess. So if you're like saving a bunch of exercises but not actually getting anywhere, it's time to level up and have somebody actually assess you. So I guess for that matter, I want to just leave people with a note that, there's so many people out there that believe that if it hurts, don't do it. If it hurts, don't do it. And I think that's what really kind of messes up people is they're in that mindset that, if something hurts, I should immediately pull back. And again, that's the lifestyle that you don't want to live because you have this window of function where before you were injured, and now your window of function starts to decrease the more that you believe into that system. If it hurts, don't do it. So, I preach that with fervency. Like I preach that so much to my clients and to everybody. And I also do have a platform. It is a virtual platform. The beauty of that is that if I can educate you, if you can get rid of pain from the comfort of your home, that you did it yourself. And I think that's the beauty of it. You didn't have hands put on you. You didn't have needles put into you. It's all yourself. And I think that I've seen so many hundreds of people to this date since I started the program, our Pain Free Academy program. So many people have changed their life, not just rely on a system and just get fed into a system. So, people are interested. It's called the Pain Free Academy. It's our online virtual platform. I have a whole team helping me that's fully bought into helping our clients and not just to pass through an insurance system where they're saying, hey, let me check your insurance. Let me see like what's their deductible, how much I can bill them for. You're not in that system. I mean, don't get me wrong. That's what you pay insurance for. But, I would also say that there are times that cheap costs, cheap copays come at a cheap quality of care. You can honestly say it that way, and then you go to somebody that's more high-end, like a high-end surgeon or high-end orthopedic doctor, or somebody that's a little bit more costly, but are actually going to save you long-term cost in the long run. And you have to think of it that way. You're paying for short-term care or something that's like a $20 copay, but what's the chances of you actually buying into that system with a $20 copay? Is that really getting your attention, or are you just going to throw out that generic stick figure type exercise program and not do it at all, right? Then you're just going to waste money over time as well. So that's why I created a system out where it really is about lifestyle changes. If you're interested, it's a decently lengthy program, but at the same time, it's going to retrain your mindset. It's going to change the habits needed so that you don't have to rely on other future practitioners in the future.
Oh my goodness, ladies and gentlemen, if you missed any of that, shame on you. But I know you did miss any of that because I know our audience, the Ilirpodcast audience, they are intuitive. They're sitting there taking notes right now. They're ready to say, hey, how can I get in touch with Dr. J? Well, he just told you where to go. I'm serious about you getting out there and taking your health into your own hands and get advice from the people who are practicing health and care. They care about you and they're going to educate you. Dr. J, this is a time when we talk about the Think, Fire, and Shoot. Think, Fire, and Shoot is a part in our show where we give you 4 questions and we give you 1 minute, which is 15 seconds per question. We're going to put you on the hot seat and then we're going to see how you do on these questions. I have no doubt that you're going to knock them out of the park, my friend. I have a feeling that you got a metal bat back there ready to knock these things out of the park. All right, so it's 4 questions. The time's already set. We're ready to rock and roll. And 1 second. So what we're going to do, you're going to come on, you're going to say, hi, my name is Dr. J. This is what I do. This is where you can find me. I am on the Ilirpodcast, the think, fire, shoot, and then after that, boom, we're ready to rock and roll. So here we go, and ready and go.
Okay. I'm Dr. Jason Wan. I'm a doctor of physical therapy and online specialist, and I help people with chronic pain. And you can also find me at www.flexdrj. I am on the Ilirpodcast right now.
All right, guys, you heard it here. Listen, it's time for Think, Fire, and Shoot with Dr. J. Wan. All right, Dr. J, setting up the clock right now is 15 seconds. The first question is simply this. Why is it important for practitioners to live or to do what they preach? Ready, go.
You're not going to get a lot of buy-in. They're going to look at you and be like, hey, you're not somebody that can actually help me, because I actually emulate what the character of what that person wants to be. So if you're a person that sits on your butt all day, that's going to be implied onto the client itself. So you definitely want some buy-in by actually preaching what you teach.
14.64 seconds. All right, ladies and gentlemen, he's heating up. He's heating up. Woo! Reset the clock. He's ready to rock and roll. Question number two. Question number two. If you had the chance to speak to someone who had one opportunity to change their lifestyle in choosing medication versus exercise and education, what would you tell them? Ready, go.
Medication is a short-term fix at a long-term cost. Exercise is going to be the long-term fix. Although it's harder, it's going to be that much better. I always say that the hardest climbs lead to the best views. So if you're down for that, if you're down to actually put in the work and put in the sweat and the grind, that's what's going to lead to long-term change.
11.65 seconds. Ladies and gentlemen, he's cooking. He's heating up. All right. Dr. J, check this out. This question is from a book that's upcoming. And the question is simply this. It said, on the highway of life, many people spend their time looking in the rearview mirror. But on the highway of living, people should focus on the windshield ahead. What say ye? Go.
What say he?
Yes.
I would say definitely it's like always looking forward and never looking back. You can have, especially when it comes to chronic pain, if you're always looking back at your previous experiences, you're never actually going to grow. But if you're just looking forward and changing and actually living in the moment, that's what's going to lead to long-term change and the lifestyle that you desire.
14.25 seconds. Ladies and gentlemen, we're coming down to the final questions right now. The final question right now. Okay, Dr. J, you're doing amazing, man. Your time, you're within the 15-second limit. You're doing amazing. But I expected that from you, right? The last question is simply this. You got 5 seconds to educate someone about a past injury that they've had, and you're going to give them one advice that they should do to try to prevent this from happening again. What would you say to them? Ready, go.
Imaging is not associated with pain. Don't be fearful. Get into the gym and start exercising and strength training.
7.34 seconds. Ladies and gentlemen, that was Dr. J. Wan. Oh my goodness, we're excited about this. I'm telling you, if you want to find out anything about Dr. J, listen, I want you to run, skip, hop, jump, and get over there to Flex, www.flexwithdrj.com. Listen, FlexWithdoctorjay.com. And you can get some more information about preventative measures to help you live happier, pain-free, and longer. Dr. J, I'm going to give you the final words. Anything that you want to say, your experience for coming here, what was your experience? Tell the people if anything you want to add to them, any programs you got out there. This is your time. Take it away, go.
Yeah, I just want to say thank you for allowing me to be on this platform. Again, I'm trying to put the care back in healthcare. And if people want to know more about me, again, it's www.flexdrj.com. I have an online virtual platform. Some people are wondering, like, that's the direction we're headed after COVID. But the thing is, like, these are different and unique ways to actually make the changes that you want. So I have an FAQ section if you want to learn more about my program. It's called the Pain Free Academy, and it's about you being the student and you learning how to get rid of pain by yourself. If that interests you at all, definitely would love to have a conversation and to help you out. And that's me in a nutshell.
All right, ladies and gentlemen, that's the conversation today. I know there's going to be a part 2. I know there's going to be comments. I know you're going to want to get some more of this information. So I want you to tune in next time to the Ilirpodcast. I'm listening. I'm ready with myself, Andrew E. Guy, and Dr. J. Vaughn is going to come back to give you some more information and to empower you and to educate you about how you can take back your health into your hand and take charge of your LIFE. That's our time. I want to say a huge thank you to Dr. J and his practice and his movement and the disruption that he's causing in the healthcare system. Until next time, take care of yourself and have yourself a fantastic rest of the day.
I'm Dr. Jason Wan. I'm a doctor of physical therapy. I just was on the podcast, the Ilirpodcast with Andrew Guy. And man, it was lit. I mean, there was a lot of fire. Obviously, he's a very passionate guy, but the passion is actually going somewhere, right? It's not just passion out of just, going straight up. It's actually feeding forward into leading a movement that's actually going to do something for others. And I'm so excited to see what the future holds for this podcast and his business and the many things that he's trying to do, because this is really changing healthcare and changing many industries for the better. So I can't wait to see more and to be a part of it.